So we have two more speakers from our OCOW experts panel. Both are occupational hygienists, John Oudick from the Hamilton Clinic and Kevin Hedges from the Ottawa Clinic. John is scheduled next. However, Kevin has a meeting at 3 o'clock. So I'm not sure. John, do you have a sense of how long your presentation is? Or Kevin, would you like to go first? I guess maybe I should.
Probably Kevin should go first.
Okay. Okay.
I can fly through mine. I've got a few slides, but I can fly through them. So,
Okay. And I'll leave you to introduce yourself and tell us how long you've worked at COVID or at COVID. We've all been working at COVID for 2 years and we don't want to anymore. But anyways, go ahead, Kevin.
Can you see my slides?
Yes, they're great. Thanks.
Okay. So I've been with OK for 5 years now. I'm an occupational hygienist at the Ottawa Clinic, and I'm former president of Workplace Health Without Borders, and I'm on the current board as well. I'm also an active member of the Canadian Aerosol Transmission Coalition, which is led by Alec Farquhar and chaired by Stéphane Bilodeau. Okay, sorry. So we all know now that COVID is airborne. The World Health Network has some very good resources on its site that it's in like lots of different languages that you can download and print out and put on the wall. Colleagues of ours, Dr. Sarah Adelman and Dr. Jennifer MacDonald, recently had this paper published in the Canadian Medical Association Journal talking about mitigating airborne transmission. There's also an interesting study from Hong Kong where they actually found people in two rooms on the opposite side of a corridor in a hotel got COVID. So, you know, it's just another example of the evidence that COVID's airborne. So it's airborne. And so, you know, thinking about prevention, it's really important to assess and improve ventilation. And just on the 23rd, the day before yesterday, this was actually published there was a White House brief from Dr. Alindra Nelson. So, you know, in US, they're really onto this in a big way now. And I expect in Canada will follow suit too. But, you know, we're just not talking about coronavirus. We're talking about all the other, you know, airborne diseases, and especially tuberculosis. You know, with the 24th of March being World Tuberculosis Day, it's kind of astounding how many people actually die from tuberculosis. I think it was 1.5 million in 2020, so it's a huge number. I just put this paper here to show you this study in Taipei, Taiwan, where they have 10,000 students in university, and they're able to monitor the ventilation and show that, you know, if you keep CO2 well below 1,000 ppm, then there's going to be a significant reduction in infections. And that's just looking at it graphically. But, you know, it's not just about ventilation, it's about all the different barriers. So ventilation should be looked alongside of all these other barriers. And John, this is the concept and the design from John Oudick as well. So really, we need to think about respiratory protective equipment and ventilation in parallel. And so we've been working madly on trying to release the version 2 OCAV ventilation checklist. We have version 1 in French and English. This is going to be a beta version. So we're asking for feedback on the ventilation checklist. So I'll just put my email in there. So as you go through and use it, we'd really appreciate your feedback. We're kind of thinking about incorporating risk assessment into the checklist. And there's some guidance there, and the BOHS has a free online ventilation tool, but really needs to think about enclosed spaces, many people, poor ventilation, many minutes as being risk factors. And going back to the 3 C's, you know, it's where the closed spaces, crowded places, close contact settings overlap, and the red piece in the middle is where we really want to hone in on. So just with the checklist, we kind of refer to the World Health Organization roadmap. They have a good process flow diagram that includes both healthcare workers and non-healthcare workers. And, you know, the checklist actually does provide practical advice about, you know, operating the ventilation system continuously, maintaining negative pressure, ventilation in washrooms, and just importance about keeping windows open. We also, you know, in there we've talking about, you know, when things have been shut down and reopened, we also need to think about stagnant water and possibly causing, you know, increasing Legionella, which can cause Legionnaire's disease. And John's going to talk about the calculator, and John has some really useful information here about air exchange rates and equivalent CO2 concentration. So really, we're trying to get the CO2 way below 700 ppm to get the ventilation up between 6 and 12 air changes per hour. You know, we really want to increase outdoor ventilation, and we really want to focus on more highly continuously occupied rooms, provide more fresh air outside where the risk is greater. So there's some just checks here about checking supply and return air grills, checking outdoor air intakes, and yet, like I said, we really need to provide special attention to washrooms, air directions, and think about recirculated air in the fixed system to make sure there's MERV 13 filters. We talked about windows being open, filters being appropriately installed, and making sure that there's an inspection and there's no gaps around the filters. Also, you know, trying to limit the number of people in an office. Try and aim for one person per office where possible. Also looking at maintaining the humidity between a certain range. And you know, there's a lot of discussion now around portable air cleaners. And if you think about the portable air cleaners, there's a lot out there. We're really looking closely at the Corsi Rosenthal box at the moment. So I provided a hyperlink in the chat box to the Clean Air Crew, and there's instructions on how to use these things. You can actually go and get the materials from Canadian Tire, Walmart, and I built one for my son's school, so it probably took about half an hour to an hour to do. It's quite simple. You know, it's also thinking about you get maintenance people coming in and looking at the ventilation system, making sure that there's you know, there's a proper risk assessment for their work as well. And you know, we did talk about carbon dioxide, and you know, the order to improve ventilation, you really want to increase the ventilation rate, then increase filter efficiency with MERV 13 filters, and then supplement with portable air cleaners. And I really, what I've added to this checklist is that respiratory protection and ventilation are linked. And the great thing, and I'm not going to go through this control banding wheel, but there is a process flow diagram that makes you look at the ventilation, and it helps you decide on what kind of respiratory protective equipment is required. And there's also an IRSS2 tool that takes you down that path. So just in summary, depending on the scale of operation, engage an occupational hygienist, certified and engineer. That's for large scale operations, obviously. As a minimum, consult with the building owner and heating, ventilation and air conditioning technician, maintenance provider. Carry out a risk assessment to identify buildings, rooms, where improved ventilation is required. Follow the OK ventilation checklist, which will be provided on our website shortly, to identify what to look for, and also the ventilation calculator, which is what John Udik's about to present, to determine air changes per hour for each room. So improving ventilation in the future is a good idea and results in numerous health benefits. And just, you know, final plea to, once you look at the checklist and use it, please provide feedback to OK. So as I said, more outside air, more natural ventilation, MERV 13, even plus more higher MERV rated filters, carry out carbon dioxide monitoring, and consider portable air cleaners such as the Corsi Rosenthal box. That's me. Thank you very much.
That's great. Thanks. That was a very express presentation, but it's good. You covered everything, and we will post the slides. And Kevin and I were meeting this morning, going through some last edits on the checklist. There's always one more thing we want to include, or a different way to say it. But it will be up on the website next week, and we will send an email to everybody who's registered so you know it's there. And we're also, which maybe John, you can talk about, but we're also creating a web version of the ventilation calculator. So there'll be a couple of new things to announce, I guess, next week. So I don't see any questions in the chat, and I know you have to go. So maybe we'll just switch to John, unless anybody has a question. They can turn on their video and let us know. Otherwise, we will send you the tool. It's meant to be, as many of the things we do, it's meant to be something that can assist in the dialogue about solving workplace problems together. So we do encourage health and safety committees and others to work their way through that.